Hi, thanks, Leslie. This is Ed Perlmutter. I'm the congressman for the 7th Congressional District. So those of you on the line are somewhere in either the north half of Jefferson County or the west third of Adams County. So we've had a number of town halls, both in person as well as on the phone, where we've discussed the Affordable Care Act in the past. And now we're coming up to the implementation of the Act. So let's just go back to some basics, and then I'm going to ask Cindy Hinman and Doyle Forrestal to add some details to my general discussion. But this is a bill, or this is a law, as we all know, that will, our exchange begins October 1st, and people come under the exchange beginning January 1st. But stepping back, the law basically extends now to all Americans. And it covers people with pre-existing conditions, which really makes it a civil rights piece of legislation, because so many families have somebody who has a pre-existing condition or some kind of malady or injury or whatever that could preclude them from having any kind of health insurance. And everybody, whether it's in their family or a close neighbor, knows of somebody affected by this. So first and foremost, it eliminates the discrimination against people with prior illnesses or pre-existing conditions. Secondly, already underway is that children of folks who are insured the children up to the age of 26 can participate in their parents' plan. And I know that benefits many families across Colorado as well as across the whole country. I have a daughter who just has turned 22. She can stay on my plan, which is a Blue Cross Blue Shield plan, until she's 26. And in many ways, young women, and women generally, were discriminated against under insurance programs, because of the fact that of carrying children, bearing babies, or the like. So there has been discrimination against women, which is, again, eliminated under the Affordable Care Act. It helps in keeping people from going broke because they aren't covered by insurance or they get kicked off of their insurance. So it eliminates that. It shrinks the donut hole for seniors who are on Medicare, so the cost of prescription drugs is reduced. I spoke to a business group today, the Colorado Association of Commerce and Industry, and one of the leaders of that group, Kaiser Permanente, just came out with a study that has shown that from 2000 to 2007, healthcare costs had gone up at about 7.5% or 8%, but since 2008, they've only gone up about 4.1%. And the goal here is to expand coverage and reduce cost, and that is what the Supreme Court found to be the basis for the legislation, and approved it a year ago last summer when Chief Justice Roberts approved the law. Now, I've been given a note to remind all of you that if you have questions and you want to get into the line, to press *3, and then you will become part of the queue and will be allowed to ask questions. I think we probably have about 15 people already signed up to ask questions. We currently have some 3,000 people on this phone call. So there are a lot of you listening to this. I think the real key here is Colorado is far ahead of really the rest of the nation in putting together its healthcare exchange to make sure that individuals and small businesses have a big market from which they can choose. Colorado has at least 18 plans with some 400 different options for individuals and small businesses to consider in providing coverage for themselves or their employees. So we are way ahead of the game. It was done in a bipartisan fashion where both Democrats and Republicans in the legislature helped put together this exchange going forward. And so as a consequence, Coloradans are going to benefit from that. Now, I'd like to take a moment and introduce Lindy Hinman, who's the Chief Operating Officer for Connect for Health Colorado, which is in charge of really this exchange. And then after that, have Doyle Forrestal, who's the Acting Director for Region 8 of the Health and Human Services Department of the United States. Let her mention a few things, and then we'll start taking questions. So, Lindy, take it away.
Great. Thanks, Ed. I really appreciate that. Just a few quick notes for me. As Ed mentioned, we are opening our doors to serve Coloradans at Connect for Health Colorado on October 1st of this year, one short month away. We're going to be helping individuals, families, and small businesses, those businesses with less than 50 employees, enroll in health insurance marketplace. There's lots of things you can do with us. One of them is to look at your health plan options and compare them based on quality, understand if you're eligible for new federal financial assistance to help you pay for your premium costs, and you can call our service center. You can sit down with us to get help in purchasing health insurance. I wanted to make sure I mentioned, if you want to learn more about us, we have many, many ways in which to do that. The best way, I think, is to go to our website, which is www.connectforhealthcolorado.com, or you can also call our call center, which is live and answer calls as we speak, 1-855-PLANS-FOR-YOU, which is 1-855-752-6749. And we're really excited to answer questions and get you educated about what we're trying to do for Coloradans in October. Thank you.
Well, if you would chime in.
All right. Thank you. And you did a beautiful job summarizing the bill in a very concise way. And I just want to add just a few things that really, because of the law, about 85% of Americans who already have insurance have stronger coverage than they did before. But for those 15% of Americans, including families and small businesses, those who haven't really had insurance in the past or have maybe paid too much, a new day is around the corner. And as Lindy said, that's coming here soon, starting in October. If you know someone who is uninsured or underinsured, or someone who works for or owns a small business, or know someone who simply wants to know more about different types of healthcare options, as Lindy said, Connect for Health Colorado is the marketplace, the health insurance marketplace or exchange here in Colorado, where those individuals can go to find out more and get information and get enrolled and sign up for health care starting in October.
So one of the things that I would like to mention again, and then if you press *3, you'll get in line to ask a question. We probably have about 40 people who want to ask questions now, and we'll take all of them, and we'll take as many as we can till 8 o'clock. So I want you all to remember that as part of this, we have groups of people that are called navigators, who are kind of like paraprofessionals in terms of helping individuals work through this insurance exchange. Insurance brokers and agents are the pros, and they certainly can do that and will continue to do it. And there are navigators who can assist individuals wanting to learn more about or participate in these exchanges. Also for people with low incomes. The way the system is set up, now let's just go back to basics. Basics are, we want people to have preventive care. We don't want people to end up in the emergency room as their first line of health care, which has been the case for too many decades now. People wait until they don't have insurance, they can't go see their own primary care doctor, they end up in the emergency room, which is the safety net for all of us. But it's also the most expensive care. And we as a country can do better than that by having preventive health care, and that is a foundational piece of the Affordable Care Act. So now with that, Leslie, we are also going to do some poll questions for all of you to see exactly where you might be on certain different issues, and with that, we'd like to open it up to questions.
Okay, thanks everybody. We'll get to the questions in just 1 second. I do want to start off with a poll question just to get everybody warmed up a little bit. And that question is, in thinking about the economy in Colorado, do you think things are getting better, getting worse, or hasn't there been a change? If you think it's getting better, press 1. If it's getting worse, press 2. If it's no change, press 3. And you can go ahead and start voting. And with that, I will turn and go over to our first question. Our first question is from Edward in Thornton. And Edward, you can go ahead and ask your question.
I am a 71-year-old veteran, and I had, at one point, I had regular insurance, and then I had COBRA insurance, and then I got diabetes, and then my insurance premiums went from $6,600 to almost $13,000. I then went and used my VA benefits to go into the VA system. So my question is, does the Affordable Care Act offer the same or better or different benefits than being in the VA healthcare system?
Thank you, Edward. That's an excellent question, and it brings us, again, back to basics. In the United States of America, we pay for health care in 5 general ways. First, there is the single-payer, single-provider system, which is the VA system. There, the United States pays, and the United States, through its Veterans Administration, provides health care. And thank you for your service, and you enjoy VA benefits which are different than what you would get under the Affordable Care Act. So the second kind of way we provide health care and pay for health care is what's called a single-payer multi-provider system, and that's the Medicare system. So there you have the United States, through our tax dollars, coming back to pay a number of providers for our senior citizens. Then you have the third approach, which is multi-payer, multi-provider, which is the insurance system that we generally use, and that is the Affordable Care Act approach is through that system. Then you have cash, people may pay cash, and then you have charity. Those are generally the 5 things. The VA system is different than what would be found available under the Affordable Care Act. Affordable Care Act is an insurance system, Blue Cross Blue Shield, Kaiser Permanente, Aetna, Cigna, that kind of a system, and you can go to any doctor anywhere. You don't have to be within the VA system. So I'll let Lindy or Doyle add to that if they like.
Ed, that's a great question. And basically, if you are enrolled in veterans health care, you can stay in your veterans health care. You don't need to make a change. Here in Colorado, the legislature did pass the Medicaid expansion. So that may be a new option for some veterans who may travel quite a distance for their health care or looking for additional options. From what I've heard from many of our veterans, are very happy with their care and use the VA as their service provider. You may do so and happily do so and not have to make any kind of changes at all. What the new health insurance marketplace offers for often veterans' families don't have coverage, so those veterans' families can go to the marketplace and seek the right kind of coverage that meets their needs and their budget. It really does give you an opportunity to shop for what meets your health needs as well as your budget for your family. So that might be an option for others you know as well.
All right. Thank you, Edward, for your question.
Okay, and next we're going to go to Jacqueline in Wheat Ridge. Jacqueline, go ahead and ask your question.
Hi. My concern is how are the physicians going to manage and know the benefits for each plan? How are they going to have enough manpower to, understand and be reimbursed?
Jacqueline, thank you for your question. I think that's a dilemma that doctors' offices and clinics already have, because there are a number of payment providers out there already. Every different insurance company does that. So one of the positive aspects of this is doctors' offices are geared up and have the administrative staff to try to work their way through this. I mean, that's sort of good news and bad news. There is clerical, weight to this, and it currently exists in the system as well. But I'll let Lindy or or Doyle jump in if they like. They're nodding in agreement with me, but I think that they would have a better answer than that.
Jacqueline, so the law does not change the relationship between the doctors and the insurance companies. Those relationships have existed prior to the new law being put into effect. One of the things that I think is important for people to understand as they may be looking for either additional coverage or better coverage, that one of the things the new health insurance marketplace will offer to you is that you can go on and compare different plans and be guaranteed of what your costs will be and what the benefits will be, and also be able to look at, plans will vary based on what doctors are part of their network, and those are the types of things you can find out before you select the plan that meets your needs. That will help you get more information and be assured that the doctor that you want to go see is part of the coverage you're selecting.
Great. Yeah, and this is Lindy, just to add to that and to augment everything that's been said. If you'll go to our website in October, there will be a provider lookup function where you can actually pull down the drop-down menu with the plan that you've selected to find out if your provider is actually in their network. So you can really understand, have a provider of choice if they're in that network, and make sure that you're getting access to that physician.
Okay, thanks very much. And now we're going to go to Ron in Lakewood. I believe he's got a question. Ron, go ahead.
Ask him.
Yes, my question is, I've been reading in the paper that Congress and the staffs, as well as the President, and the spouses and families will be exempted from this. Is that still going forward, or is it going to be changed?
Ron, thanks for your question. I'm not sure which paper you're reading. There are, the emails. Well, if the Post said that, then the Post is wrong.
All right.
Generally, the emails, there's always a rumor mill through the emails that say Congress gets gold-plated health care, and Congress exempted itself from this, and Congress exempted itself from that first, and congressmen and women get pensions the first day they are on the job, and all of that stuff. And so I want to disabuse everyone on the call about this. First of all, the language specifically requires members of Congress and their staff to be part of the exchange throughout the United States. So my staff and I will be in the exchange starting January 1st. We'll be able to choose from the different options and plans that are available, and we will do that. My law firm, before I became a member of Congress, I had Blue Cross Blue Shield. Today, as a member of Congress, I have Blue Cross Blue Shield under the Federal Employees Program, and my guess is that come January 1st, I'm going to be with Blue Cross Blue Shield again. All right? But each of us can choose from the various options. There is a free marketplace for us to do that. Just as at my law firm, where my law firm picked up part of the cost of my health care as a lawyer in the law firm, the federal government picks up part of my cost as a member of Congress. But I pay the rest of it, and I pay for my spouse, and I pay for my child as part of this whole program. So if the Post said that, the Post was wrong. And I do believe it also applies to the White House and a certain high-level number of staff members in the White House. For other federal employees, the other 1 million or 2 million federal employees will still stay under the federal employee plan, which has a number of different options, Kaiser or Aetna or Blue Cross Blue Shield. It's a big employer plan. They'll be able to stay with that. While I'm on the topic of disabusing myths and rumors, the email that seems to resurface every other year that congressmen and women get full pensions the first day they're on the job is nothing but baloney. You have to win 3 elections. You have to be elected for at least 3 terms to vest at all in any kind of a pension plan, and that vesting then is in slivers for each time you win. So it takes 15 election cycles, 30 years to be fully vested, and that's about 3/4 of my salary. Right now, I don't know exactly what the number is, but I've been elected now. This is my 4th term. I'm in my 7th year of Congress. I think that if I were to retire or whatever, my pension would be about $1,100 or $1,200 a month. So, or maybe a little more than that, but not much. So, whether it's in the post or it's the emails that circulate every so often, everybody just do your homework just as Ron just did. Thank you.
Okay, and I just wanted to give an update on the poll question that we asked earlier. In thinking about the economy in Colorado, do you think things are getting better, getting worse, or there hasn't been a change? 345 total people voted, and 37% said it's getting better, 32% said it's getting worse, and 31% said there's been no change. And just a reminder to everybody, if you'd like to ask a question, you can press *3. We've had more than 5,300 people join the call with us tonight, and so we're going to keep plowing through the questions and see how far we can get. Our next question is from Linda, and Linda's got a question about mental health services in Jefferson County, I believe. Go ahead.
That's correct. Good evening, everyone. I'm Linda, and I reside in Golden, Colorado. And for about the past 11 years or so, I've been very involved with the Summit Center, which is under the auspices of the Jefferson Center for Mental Health. And having gotten to know numerous people there, club members, many of them are not able to work, and many of them are well below the age to collect any kind of Social Security if they did work at all. What happens to these people when they need medical care? Because from what I can see, a lot of them just fall through the cracks. You know, either they make a little bit too much, so that means they're going to have to pay full price or whatever for back surgery, which I know one individual really could use. I mean, it's really a concern. I am fortunate enough. I have Social Security as my primary, and then I've got United Healthcare as my supplemental. But what avenues do we have? What prospects do we have for these people?
Okay, Linda, thank you for your question. I want to make sure, I don't know if you're still on the line, but have you been able to hear us?
Yes.
Okay, great. All right, I'm going to take one part of your question, which you didn't really ask, but you talked about, you mentioned that you were with Summit and Jefferson Center for Mental Health. That is something I completely forgot to mention in my opening. In this Affordable Care Act, mental health issues are part of the whole package of services to be provided to individuals, because obviously mental health issues affect physical health, and physical health affects mental health issues, and you got to end up treating the whole person. So that is a key piece to this, and I thank you for reminding me of that. Now, as to your specific questions, I'm going to turn it over to Doyle and Lindy.
Okay. Linda, I'm so happy you're connected to Jefferson Center. They do a wonderful job, and I really want to let everybody know about the new mental health and substance use treatment options that are part of the Affordable Care Act. So the law does make it, it makes it so that behavioral health services are required as an essential health benefit in all insurance plans moving forward and in Medicaid. And so those folks who, like you said, have fallen through the cracks because either mental health and substance use wasn't a part of their benefit package if they did have insurance, or maybe they weren't eligible for Medicaid or some type of other assistance. Now that Colorado has done the Medicaid expansion, we will have this new option for a whole host of people who need mental health and substance use treatment who haven't been able to get it before. A lot of what we've seen have been those adults without dependent children who have not qualified for Medicaid in the past, who will now and will be able to get into services, whether it be at Jefferson Center or even with a private provider. Just last week, the President hosted a behavioral health roundtable at the White House with the Vice President to bring mental health and substance use providers together to talk about the importance of their participation in the new law, making sure that people understand that they can go to those providers and that their insurance will cover it, and that those folks have new options to bring clients who have, like you said, fallen through the cracks to get their behavioral health services. Additionally, we know that people with serious mental illness die about 25 years younger than the general population because of exactly what you just said, Linda. They don't get the health care services that they need. So those folks now will also have, whether it be Medicaid or private insurance, to cover their health care. And preventive services, especially, a lot of folks use tobacco. Getting those preventive services, tobacco cessation is a covered preventive service, and we really encourage.
Linda, thank you. That's a great question.
Okay, thank you, everybody. And Doyle, we lost that last part from you, so we'll remind everybody that we'll try to speak closer to the phone, but sometimes we might lose parts. Okay, Mac Goodman is going to be our next caller, and he's from Thornton.
Hi, Mac.
Hi, Ed. How are you tonight?
I'm good. How are you?
I'm doing great. Sitting out here filling a questionnaire out for UFCW.
Okay. What's your question?
Well, I was just wondering, I've been looking at some financial stats on income for hospitals in particular. And with the Affordable Care Act, we're making sure that the insurance companies are holding their costs down to an affordable cost to everyone. But yet, with a 13% average income every year to the hospitals in particular, what can we do with the Affordable Care Act to hold that cost down to a reasonable level rather than, that sounds like pretty hefty profits.
Well, I'll take just a quick cut at it, and then let Lindy and Doyle take a shot at it. But what I said at the beginning, we are already seeing slowing of the health care costs. They continue to rise, but not nearly at the rate that they were from 2000 to 2007. There are a number of provisions in the bill that really try to bring value to and quality of care to the individual and savings to the United States of America taxpayer, to try to avoid return visits to the hospital, to make sure that in nursing homes, there's a big section of the bill on elder fraud and abuse and neglect, and so to try to get the best kinds of services and the best quality of care from our nursing home facilities, so that people are well cared for and aren't going to the hospital a lot. So there is real pressure on the healthcare provider, the doctors, the nurses, the hospitals, under this act, and as a consequence, we've seen the slowing of the increase of healthcare costs. There is also this thing called the Accountable Care Organization, where kind of on a continuum of care, the nurses, the doctors, the hospital, all get together and try to have the best whole care for the patient possible at the best possible price. So there are lots of pressures to keep down health care costs, and then there is an overall kind of pressure on insurance companies to keep down administrative costs.
Yeah, and this is Lindy. I think that from the Connect for Health Colorado perspective, I think, as you said very well, we're really focused on providing choice and transparency and competition in the health insurance marketplace. We are not focused on the interaction between the insurance providers and the hospitals and doctors, et cetera. That is not our role. So what we're really trying to do is provide consumers options and choices and ensure that there's a healthy range of premiums available to consumers so they have those choices. But we are not interfering, I think as Doyle said before, in the contracting between the insurers themselves and the physicians and hospitals. That's really not our role. We're really focused on the insurance marketplace.
And Mac, I just want to add one other thing that's in the law is what we call the 80-20 rule, which mandates that insurance companies must spend 80 cents of every premium dollar on actual medical care or medical improvements. So in the past, where we would often hear stories about high CEO bonuses or insurance companies purchasing property, those days are over. They must demonstrate that they're spending 80 cents of every dollar on actual medical care, and if they do not comply with that portion of the law, that money goes back into your pocket. And we have a great example just last year when that went into effect, where the city of Pueblo actually got almost $500,000 back from their insurance company that they were using to cover their city employees. So as we know, with tough economic times, whether it be the state or a city or a county that is looking for extra money in their budget, this is just one example of what we're doing to keep costs down. Now, we didn't give back as much money to the consumers this year because the insurance companies were much more compliant this year. So that is one way that we have been able to demonstrate that your dollar is, as Ed said, the value that you're getting in the health care that you're purchasing is actually going to your medical care.
Thanks, Mac.
Thanks, everyone. And just a reminder for those of you on the call, if you'd like to ask a question of the panel, press star 3 on your keypad and we'll get you in line to ask a question. We're going to do one more poll question, and the question is, how do you currently receive health insurance? Press 1 if it's through your employer. Press 2 if it's through an individual policy that you purchased. 3 if it's a government-sponsored health insurance plan like Medicare, Medicaid, or the VA. Press 4 if you're uninsured. Again, 1 if it's through your employer, 2 if it's an individual policy, 3 if it's government-sponsored Medicare, Medicaid, VA policy, or 4 if you are uninsured. And now we're going to go to our next caller, who is Donna in Arvada.
Hi, Donna. Can you hear us?
I can hear you. Thank you for taking my call.
Sure.
My question for you this evening is, my son was recently laid off about 6 months ago, and about at that same time, he and his wife found out that they were expecting their first child, and it turns out to be twins. And they have no insurance. Under the Affordable Care Act, will they have any options for those without jobs that they can get coverage for themselves and their children as well?
Thank you for your question. That's a tough situation they find themselves in. I hope that the twins, can you tell me, are they healthy? I'm just curious.
Well, they're not born yet.
She's 6 months pregnant. I'm sorry. I thought they had them 6. Okay, I'm sorry. Well, hopefully they'll be healthy. I guess what I would say is, for the children, for the babies, there is already in place coverage for children up to the age of 18. It's through the Children's Health Plan. Both Colorado and the United States have that. The babies have some basic coverage. For the parents, until we get to the exchange, they really don't have much other than the expansion of Medicaid at this point. But I'll let Lindy and Doyle address it because they really are the experts on this.
Great. So I think depending on the situation and their income, and it sounds like maybe that won't be significant because of the job loss, but there's, I think, 2 paths potentially. The first is if you come to the exchange, for those at a certain income level, and for a family of 4 actually up to $94,000 a year, which is fairly significant, you can get access to premium tax credits, which really help you with the cost of your premium every month. And in some cases, it's significant enough that people will have 0 premium plan options. So depending on your income, it could be a very, very big benefit to you. And then I'll turn to Doyle to talk about the Medicaid expansion, but depending on their income, they also may qualify under the Medicaid expansion.
And I will say one other quickly before Doyle. There is also a system, and we're very lucky to have it in the metropolitan area, called the Metro Provider Network, or MCPN, plus you have the Salute Clinic. You have a number of different clinics that can provide some very good care for the mom and for your son in their current status of not having any work. It really helps people with low to no income. So these clinics, like a new one was just completed over at the corner of 29th and Wadsworth. That's an MCPN clinic. In Commerce City, there's the Salute Clinic, and there are a number around, and they provide excellent medical care that may be available to your son and daughter-in-law. I'll let Doyle and Lindy jump back in.
And sorry, this is Lindy. One more comment that I think is very important related to this in your particular situation is that on our website right now, www.healthcolorado.com, there's a calculator that you can access where you can type in your financial situation, and it'll give you an estimate of what you might qualify for in October. So that's really important, and if you haven't had a chance to go to our website, I think it's really great to get on there and start to understand what you might access.
And Donna, this is Doyle. I just want to add a couple of additional things. The new health insurance marketplace does open in October, so that will be coming soon, but that's really for coverage that begins in January. So as far as options for your son and your family right now, the Medicaid expansion was part of the law as a way to really help low-income individuals get health care. Again, that will start in January, that Medicaid expansion, which is really just income-based as an opportunity to get that health care. Before, people had to qualify based on a disability or being a low-income family. Those qualifications will be going away, and all you need to know is that you qualify based on your income. Now, for the mother, she could potentially get onto Medicaid today and begin getting that prenatal care and some of the assistance that she will need so that we can be sure that she's taken care of immediately. And then definitely want to make sure that you get on connectforhealth.co.com to look at those coverage options that will be in place starting in January. But you can start enrolling for both Medicaid, the Medicaid expansion, and the new health insurance options starting in October, but would definitely recommend that the mother look at the Medicaid option today since she is pregnant. That might be an option for her.
And Donna, last thing, for your son and daughter-in-law, if they want to call our office, we will certainly do our best to connect them with the right people, and that's 303-274-7944. Thank you for your question.
Okay, thanks very much. Our next question is from Tom in Arvada. Tom, go ahead and ask your question.
Yes, I'm wondering, where does the hospitals and the doctors get their money from?
Okay.
They have to be paid. The hospital has to have operating money. I was just wondering where that comes from.
I mean, you're asking one of the most basic questions is why do the providers provide service? So they will be getting money from the insurance company, will be under the Affordable Care Act is the main avenue of payment. So they, just like today, for most people in the United States, the money will come from the employer's insurance provider. So for me, it would come from Blue Cross Blue Shield, and I pay premiums to Blue Cross Blue Shield, and hopefully I never have to take advantage of the insurance that I have. But if I do get sick, Blue Cross Blue Shield, I'll have a deductible of some level or copay of some level. Blue Cross Blue Shield pays the rest. Same approach applies under the Affordable Care Act. Now, for those people with very low income, there are certain subsidies up to $94,000 for a family of four. And so there's various tax credits that are available as well as a number of subsidies, the belief being that at the end of the day it's cheaper to go through the insurance approach and that people have prenatal care, that they do have preventive health care than what we currently pay to hospitals and providers when somebody goes to the emergency room. So we believe, and we're covering a much broader group of folks with pre-existing conditions. So the goal here is to have expanded coverage at lower costs. The providers will still receive payment for their services. Hopefully we slow the rise in costs of services and, different kinds of equipment, etc. And we'll just have to see if this works. But we believe that it will. We know other nations that have pretty much universal health care for the citizens of their countries, that they have generally pretty good health at far lower cost than what we have in the United States of America. And so our goal is to continue to provide good health care, but find some ways to have more preventive health care and to make sure that everybody's covered and they don't immediately go right to the emergency room.
Thanks, Tom. We'll take several more questions, but I wanted to remind everybody before our next question that you will be able to listen to a recording of this town hall on our website at perlmutter.house.gov. After tonight, we'll get a recording and put that up. And you can also call our office if you have more questions. That number is 303-274-7944. And again, we're going to try to get to as many questions as we can, but we've had almost 6,000 people on the call with us tonight, so I don't think we're going to get to 6,000 calls or questions, but we're going to get through as many as we can. Our next question is from Jane in Thornton. Jane, you should be live and able to ask your question.
Hi, Jane. Jane, you there? I don't know where Jane is.
We may have lost Jane. Okay, then we'll go to our next question from Donna in Arvada. Donna, let's try this again and see if you can ask your question.
Yes. Are you there?
Hi, Donna.
Yes, hi. My granddaughter just recently divorced, and she has a little girl, and her health, the mother's health isn't too good. Since she was on his insurance, now they're divorced and she has no insurance. Where can she go to get affordable insurance?
I'll let Lindy or Doyle join in on this. But again, there are health clinics around that could be a potential place for her to get good medical services, but there are other avenues besides that.
Thank you.
Yeah, and Ed is exactly right. There was some enhancements in the law for our community health centers, which Ed has talked about a couple of times. They are in your local community. They're great providers. They offer lots of different services. Some have dental. Some have mental health provisions as well. So I would definitely go there, and vision. Thank you. But additionally, a lot of what we're talking about now is exactly what you are asking. We have millions of Americans across the country who don't have insurance. The whole idea behind the law was to get them coverage, get affordable coverage for them. So the new health insurance marketplace will be open for business starting October 1. That is where she can go to look for the different options that are available, and I know Lindy will give more information here in a second. Medicaid may be an option, and CHIP most definitely is a good option as well for her daughter. So there are some public programs that are in place that are administered in the state of Colorado that will help in this gap time for her, and then hopefully come October she can select a plan that makes the most sense for her.
Yep, and this is Lindy, and I think Doyle said it best. Again, our doors open in October. You can come on our website right now and start to understand what you might get access to in October, and obviously the benefits don't start till January. But you'll be able to understand if you qualify for these tax credits that I've mentioned before and really understand the plan options that are available to you. So again, I just started to reiterate to everyone, but the website, just so I can make sure I plug it as many times as I can, is www.forhealthcolorado.com. You can go there right now. You can call us, 1-855-PLANS-4U, and start to get more information about what you might get access to when we open in October. Oh, thank you. And I'm being prompted to also remind everyone that we will have in-person assistance, whether through a broker, an agent, or, as Ed mentioned, a navigator. We're calling them coverage guides. They're out there in the community to try to help people with their options and really understand what they might be able to purchase.
And there are many of those. So we know you know, and pretty much everybody on this call knows, insurance brokers, agents, they certainly know how to, and are learning more and more, but obviously can help on this. There is this second group, navigators or health guides, and those are a lot of charitable organizations and different groups that have learned a lot about it. The Jefferson County Library is providing assistance for folks to try and understand this. You can go in, use their computers, talk to their people. They will assist to get you to the right place, to the Connect for Colorado website, and will help you in that respect. So, or you can always call our office, because we expect a lot of phone calls. We also expect that there will be bumps along the way. And for those of you that have experienced those bumps, our goal is to get this to be as smooth as possible. You need to let us know. And we want to make it work as best as it can.
Thanks. And I just want to remind everybody one more time, if you've got questions, please press *3 and we'll get you set up to ask your question. I do want to give the results of the last survey that we did. The question was, how do you currently receive health insurance? 249 people answered the question. 22% of you said you get it through an employer. 13% of you said you get it through an individual policy. 62% of you said you get it through a government-sponsored plan such as Medicare, Medicaid, or the VA. And 3% of you are uninsured. And with that, we will go to our next question from Don in Arvada.
Yes, my name's Don Waters. I'm from Arvada, and my question is, why did President Obama elect to have companies defer the implementation of the act until 2015, and what gives him the authority to do that?
Good question, Don. I will let Doyle answer this one the best she can. It was a surprise to members of Congress when there was this extension granted to certain companies to delay entry into the marketplace. And I'll let her, as a representative of the executive branch, answer the question.
Okay, Don, thank you, because this is a really important distinction that we should make, because there's so much confusion about what the law does and how it affects our business community. So the first thing that we always try to clarify for folks is that you are not required to purchase insurance for your employees if you're a business with fewer than 50 employees. So that's one of the things that a lot of small businesses have been concerned. The whole idea behind this law was to help individuals and small business afford health care for both their employees and for their families. So the health insurance marketplace is that option for small business who want to provide insurance for their employees so that they can find affordable coverage that meets the needs of those individuals. As you just stated, there was a decision made recently to allow large companies some additional time to comply. Now, large companies are required to provide insurance for their employees, and if they don't, they have to pay what's called a shared responsibility fee. And the whole idea behind that was really to help offset the cost, because those individuals who don't get coverage through their employer may go to the marketplace and they may be eligible for some type of tax credit. So to make that fair, the idea was that large companies who selected not to provide insurance to their employees would have to pay a portion back to the government to help offset the cost of those employees getting coverage. Now, as you just stated, that piece of the law was delayed for 1 year, and part of the reason behind that was that it was believed that it would affect very few companies, because about 95% of the large companies in the country already provide health care for their employees. So we had heard some horrible things, and there was no protections in the law to help those employees who may have been receiving a cut in their hours, because the employer thought that that would be a way to get around this provision. So we did allow for that 1-year delay for those companies. However, the other reason, so one is that it would hopefully not affect too many companies since most already provide insurance for their employees. But because the new health insurance marketplace is going online this year, those employees who haven't had coverage can go into the marketplace, and most of the people who go into the marketplace to shop for insurance, about 90% of those individuals will receive assistance, premium assistance, to help offset the cost of that coverage.
Thank you, Doyle, and I appreciate that answer. I think the other thing this reminds me is, for the insurance piece, the bigger the pool, the better the coverage for individuals, and you spread the risk of somebody getting real sick across a bigger pool. It is the main principle of insurance. And for small businesses that had 15, 10, 22 employees, sometimes that group was so small that any one person could have caused that group to be disqualified. So for small businesses, this is the ability to join a much bigger pool and be able to participate. That's why in Colorado we have 18 plans and 400 options available, plus Lindy and a number of other people have been working overtime to get this thing set up. There are other states that they thought either President Obama was going to be defeated or that the Supreme Court would strike down the law. Well, those states were sadly mistaken, and they are way behind. And it's going to cause their people a lot of trouble. Now, the administration took into consideration some of that trouble and is trying to deal with that and assist. Colorado, on the other hand, and again, it was in a bipartisan way, said, you know what, we're going to keep moving forward. We know that some people think the president will be defeated. We know that some people think that the Supreme Court will strike this down, but we're going to keep moving forward anyway. And consequently, we're ahead of pretty much every other state of the nation. So that was an excellent question, and appreciate you bringing it up.
All right, thanks again. And our next question is from Susan in Lakewood. Susan, go ahead.
Susan, you there? Leslie, you're losing them.
I know. I need to get a little more interesting here. All right, then we will go to our next question. Will be from Lily in Commerce City. Hopefully Lily can ask her question.
Hi, Lily.
Yes.
Are you there?
Yes, I'm here.
Hi, Lily.
Well, I kind of have two questions. One question is for myself, and that is I'm a retired government employee on Social Security and Medicare, and I also have a government back.
Pension.
I'm talking about the insurance. I have the government insurance plan, and I was wondering if there's going to be a change to that. And the other part of my question is kind of for my family and some of my daughter, granddaughters, and so forth. You keep saying these affordable plans, but what I'm hearing them say is that the premiums are going to be $1,000 a month, and they're going to have a $12,000 deductible. And I'd like you to address that question as well.
Okay. Well, I thank you for bringing that up, and I'll let Lindy address the second part. The first part, you're a federal employee. You were a federal employee unless you are a member of Congress or a family member of a member of Congress, or you're part of the White House staff. You're not going into the exchange. You're still part of the Federal Employee Benefit Program. Okay? I don't know precisely what kind of coverage you have as a retired. You probably are a NARF member or something like that, so you may have some coverage as a retired federal employee. You clearly have your Social Security. You have your Medicare. So you have sort of 3 layers of help there. With respect to your kids and the rumors or what they've been saying.
Well, this isn't rumors. They've been talking to the people, and this.
Okay, I'm going to let's let Lindy kind of respond, and then I want to know precisely who they talked to.
Oh, I can't.
Not to get mad at that person, but I want to find out what it is that they're saying. So I'm going to let Lindy respond.
Okay.
So we know we've seen the rates that have been coming out of the health plans that will participate on Connect for Health Colorado, and the good news is we're seeing quite a nice range of options for consumers, and that includes some very low-cost plans that'll be available. And in fact, some people, again, that may access these tax credits that I've referred to, depending on your income range, you may even see a zero premium option. So I'm not going to guarantee that for everybody, but there is a nice, healthy range, and we're seeing a lot of competition in this marketplace, which is very exciting. I think what's important is to get educated about what your options are in October. And again, I'm going to just keep plugging our website, but when you go onto our website or you call us or you talk to me in person, they can talk to you on October 1 about what those plan options are, because obviously every plan is different for every individual. You need to pick the one that's right for you. You may want a low premium plan with a higher deductible, just as an example, or one with a lower deductible and a higher premium, depending on what you think your expected medical expenses might be. But the opportunity here is to shop and compare, really understand what you're getting. But I will tell you, we're very pleased with the prices that we're seeing on the marketplace, and I think I encourage everyone to take a look.
And really, by opening up on October 1st and by Colorado having so many options for people to study, by going to the website for Colorado Connect, people really are going to have this marketplace right in front of them. And you can say, I'm 27 years old, I'm married, and I have 2 kids, 6 and 7, and I make this kind of a money, and these are my options. What are my options? And so there really will be the opportunity to compare plans like people have never really had before. Now, they may want more expert help in deciphering some things, and that's where your insurance broker or insurance agent or these health guides come into play. But the individual is going to be able to really take a good first cut at what costs and what services are available to them. Okay, and just thank you for that question. We have a couple, 3 minutes left on call, so we'll take one more question.
Yep, okay. I'm going to go to a question from Nancy in Federal Heights. Nancy, go ahead.
Yes, I've heard that doctors are going to have to go to computerized accounting, and some of your small doctors feel they need to go in with other doctors or go out of business as it would be too expensive for them to continue. Now, is this raising the level for them, or?
Okay, I think your question is they're probably already on computerized accounting, just so they can handle all of the insurance plans that come through there. I think what you're talking about are computerized health records, electronic health records. Right. And the Affordable Care Act does push nursing homes, doctors, hospitals, all providers to come up with electronic health records so that a person, if they go see the hospital can pull up those records. They go to the new doctor, the new doctor can pull up the health records. The belief being that you have the individual has more complete, or the provider has a more complete health picture of the individual they're seeing, of their patient. And so most of our hospitals, many of our doctors have already converted to electronic health records. There is real pressure on nursing homes and nursing home facilities generally to do that. That hasn't occurred. But for your question, the answer is yes. There is pressure to go to electronic health records under the Affordable Care Act, belief being, again, better care, lower cost. So good question, and now we got to wrap up. So I want to thank Lindy, I want to thank Doyle for joining me tonight to help me discuss what's coming in terms of the Affordable Care Act. The marketplace opens October 1st. People can then study their options, look for different kinds of insurance and plans, and really start making some very good informed decisions. And luckily in Colorado, we're ahead of the game. That opportunity is there. The overall act, the design is to expand coverage and lower costs, provide quality medical care for so many people that don't have it today. And we heard from some callers, whether it's because of a divorce or because of a layoff, because of some catastrophe that may have occurred or something very unexpected. People stumble and have hurdles to overcome in our country. And this is a way to assist families and individuals have healthier lives, and hopefully this will work. And we need to hear from all of you as you participate in this to give us your feedback. Thank you all very much. There have been some 6,000 of you on the call. We appreciate your time. Bye-bye.